Dr. Shane Retty.
Thank you, Mr. Speaker. It's a pleasure to take this, the last call on the Health Practitioners' Replacement of Statutory References to Medical Practitioners Bill. Mr. Speaker, this bill recognises the increasing skills and changing range of skills in the health workforce. I think enacting this legislation will do several things. First of all, I do believe it will improve the efficiency of the health system. Will also advance the career pathways of many, and I believe it will improve job satisfaction as well. There are several acts that this bill changes, and I've looked at what the key change, in my mind, is enacted on each of these acts. The ACC Act 2001, it changes the terminology from medical practitioner to health practitioner, which is the core function of this bill. Burial and Cremation Act 1964, a certificate of cause of death may be undertaken by a nurse practitioner who attended the last illness and has this in their scope of practice. The Children and Young Persons and Their Families Act 89, this will enable suitably qualified health practitioners to undertake and manage medical examinations of children and young persons. The Holidays Act 2003, this bill will enable a health practitioner to complete a sick note, and I think this part of the bill will probably touch more New Zealanders than maybe some of the others, and I see this as a real efficiency in my clinical hands, and I think this is a really good piece. The Mental Health Act 1992, it will require engagement with a primary health care provider. And the Misuse of Drugs Act 1992, it clarifies the use of controlled drugs as it relates to import, export and prescribing. Mr. Speaker, I think widening the scope of practice for health practitioners overall will not increase the risk of harm to the public. And I know this was a concern from the Medical Council and Medical Association. And I think the concern of risk to the public is addressed by two prime mechanisms. First of all, appropriate scopes of practice, which are determined by the Health Practitioners Assurance Act 2003. I think this is very important to reassure the public and to reassure the profession. Secondly, I think, as has already been commented on, oversight by regulatory bodies such as the New Zealand Nursing Council and the New Zealand Medical Council. So, Mr. Speaker, it has taken a long time to get this bill here to its final reading, but it's with great pleasure that I commend it to the House.
Members, the question is that the motion be agreed to. Those of that opinion will say aye. Aye. And to the contrary, no. The ayes have it.
Accident Compensation Amendment Bill Number 2, third reading. Burial and Cremation Amendment Bill, third reading. Children, Young Persons and Their Families Amendment Bill Number 2, third reading. Holidays Amendment Bill Number 2, third reading. Land Transport Amendment Bill Number 3, third reading. Medicines Amendment Bill, third reading. Mental Health Compulsory Assessment and Treatment Amendment Bill, third reading. Misuse of Drugs Amendment Bill Number 2, third reading.
Call on Government Order of the Day Number 9.